Hello and welcome to Mother Tongue, the podcast where modern motherhood meets real life. I'm Marianne, founder, podcast host, and mum of three, and I created this space for all the mums who are juggling it all. From toddlers and tantrums to businesses and burnout, we're talking about what it actually takes to build a life, a career, and a family all at once. Here, you'll hear honest, unfiltered conversations with founders, freelancers, experts, and everyday mums about work, wellness, identity, mental health, relationships, and everything we carry that no one talks about. Hit follow, join our community, We Are Mother Tongue, and tune in for real talk that supports the whole you, because modern motherhood is busy and no one should do it all alone.
We are so incredibly excited to welcome Jane Phillips to Mother Tongue. Jane, how are you? Thanks for having me. Thanks for coming on your day off. It was still on weekend at work. I was about to in A&E. I mean, I just felt like this is actually should have come to you. Saying that, you're probably rushed off your feet 24/7.
Yeah, it's not really in place to sit and have a quiet.
No, you're right. You're absolutely right. I mean, I feel like I've kind of given away what you do, but can you just tell us a little bit about yourself?
So I've been working in emergency medicine for over 20 years now, nearly 25 years actually. And I've had the privilege of working in Australia, London, Singapore, and now Dubai. So I've been traveling around the world and working in emergency wherever I go. And it's amazing how the same things reappear time and time again.
Well, I was going to ask, which part of the world has more accident-prone toddlers?
They're all equally as accident prone. I think they're all equally as vulnerable at that age as anywhere around the world. So yeah, I don't think it. Singaporeans tend to probably they have multi-generational living, so they have a lot of family.
Yes,
I feel like they're slightly more wrapped in cotton wool, really. I think.
Okay,
More, but it doesn't stop stuff from happening.
No, I just don't think it ever does it? We've obviously talked about this a little bit off air, but why is the toddler age such an accident-prone age? I mean, I think nearly every parent that I've spoken to has been to A&E with their toddler at some point.
So just to clarify, toddler is age 1 to 3. That's the kind of age group that we're talking about. And they are vulnerable for many different reasons. They are rapidly physically changing and learning. So if you think about that age range from 1 to 3, a lot of toddlers will crawl, to walk, to climb. So they are going through this rapid period of growth where they don't really have the balance or the coordination to match that necessarily, which makes them prone. They also have absolutely no safety awareness, which is what makes them incredibly vulnerable and prone to, and they are naturally curious.
Yes.
So they will climb things, they want to pull things off surfaces, they want to put things in their mouth. All those different reasons. And also we can't be there for every little thing. Often toddlers may be dealing with other children. You can't be everywhere all the time.
No, can't have eyes.
So trying to preempt some of this stuff, and that's hopefully what we'll talk about a bit today, is talking about how we can prepare our houses and our environments to try and minimise the risk to these children. But it's not possible to make it a zero risk environment.
Well, let's start there. I'd like to. Obviously, I think we're going to delve into a lot of bits today. But when it comes to common accidents that you see at home, what are the most common things that you see, both minor and major?
So I think the important thing is that the majority of things that happen are minor. Okay,
that's good.
Yes, we see a lot of minor things in emergency. Minor to us, I suppose, may not be minor to the parent. Yeah, coming from a medical point of view, which is good. So falls, I suppose, are the biggest thing that we see. Falls and head injuries, and as I said, the majority of those head injuries are minor. But falls from a sofa, falls from a bed, fall from climbing onto a table, fall from a bunk bed, all these things. So falls are probably the commonest thing that we see, and the sequelae of those falls can be anything from a bit of a bruise to maybe a small cut, to maybe a broken arm, a broken collarbone. So there's lots of things that can happen after that fall. But that's probably the commonest thing that we see. Burns are not uncommon. Unfortunately, the toddler putting the cup of tea to the surface, pulling it from the coffee table. They're just learning to stand. They put themselves up to stand, look at the coffee table, or look at that cup. It looks interesting. So we see burns, unfortunately. Drowning, we will talk about a bit later, because sadly that is something that we do see. Kids can drown in an inch of water. People often think of drowning as being in a swimming pool or in the sea, but actually the commonest way that toddlers drown is bathtubs and toilets. Yes.
Explain how a toddler drowns in a toilet.
Because if they are curious and they're looking into it, and they fit, so they can't get them out again.
Stop. Oh my God, I actually don't think all my children have been so large. I don't think they've been to the toilet, to be fair. Even my 5-month-old, I'm not sure bit in the toilet.
I mean, that's not something that any of us would ever really think. You're taking a risk in your an inch of water, really, they can drown in. So, it's that, but we'll talk about it a bit more. I think being no supervision, you really should never let your child bath alone. And also make sure you never leave any bath water.
No, that's actually another very, very good point.
Drain the bath as soon as someone's finished in it, so it doesn't become a hazard.
We often do that as well. God, that.
I know, terrible, right? The other things we often see is things like ingestion as well. Eating things they shouldn't, and that some of those things will be completely harmless.
Yeah.
And some of them will be more harmful. We'll talk about that a bit later. Into choking, obviously, as well. Some ingestion, so choking is something we see uncommonly as well. And I think that's a really big fear for most parents. Drowning and choking, I feel, is I'm a parent of 3 children. They're now a bit older, but definitely things that I was worried about as a parent. I think were those 2 biggest things. Maybe head injuries as well.
Yeah, well, so I want to come to the head injuries because we've had our fair share of head injuries, and I have friends who have had really bad head injuries with their one spring. Mine in particular, I mean, he constantly is banging his head, falling off things, cutting open his chin.
Yeah.
I mean, he's very accident prone, poor little thing. But I want to understand the difference between a bad head injury and a not so bad head injury, because often as parents, we panic if it sounds bad. But what are the signs that we should seek medical care instantly versus we should stay at home, monitor the situation, and then
see based on what comes back? Okay. So I think the important thing is that if you're ever worried about your child, we would much rather see you in emergency and reassure you that everything is okay and have home reassured. I hate the thought of thinking that a parent might be at home really worrying about their child. Should I take them? Should I not take them? If you've got any concerns, bring them.
Okay.
So we would much rather see them, reassure you and send you home. Now, when we're taking a history from a parent and a child who's had a head injury, there's certain questions that we'll ask that make us, start to process, do we think we need to worry about this child, or are we happy to send them home? Vomiting is quite a big thing. Yes, but conversely, some children vomit and will not have a head injury. So it doesn't necessarily mean that you've got a more severe head injury, but that would be a sign that we would want to see somebody. If a child has lost consciousness for probably more than sort of 5, 10, 15 seconds, we might want to see them just to assess them and reassure them. If they're behaving abnormally, if they're very drowsy, if they're confused, we would definitely want to review them. Now, if we see a child in emergency who's had a head injury, who's got some of those symptoms, we don't necessarily CT scan them. That would be our investigation of choice to check there's nothing going on. We follow quite strict guidelines, international guidelines that all emergency departments use to risk stratify those children who need scans and who don't. We don't want to overscan children. We don't have to submit them to radiation if we don't have to. Conversely, we don't want to underscan those children that need it because we're worried about giving them that radiation, right? So it's a balance. The majority of children we see will be in that green zone of not needing a CT scan, just need reassurance, and then we send them home with head injury advice. We have written head injury advice that we give to all parents. The red flag, so there's signs for those children to look out for in their kids, which means we need to see them again.
Babies, for example, I feel like you probably see a fair few babies who have rolled off the bed.
And the commonest place they seem to roll off is either the bed or the changing mat.
Yes, often. I've been there. My eldest, I remember him rolling off the bed like it was yesterday. It was terrifying. And it always seems to happen before bedtime.
Yeah.
So I remember someone once told me, wait 30 minutes. If they are totally fine for 30 minutes, you should be all right. Is that sound advice? Or if they roll off the bed, how long should we monitor them before we actually put them to bed?
That's quite a hard question to answer.
Yeah.
There's no real medical kind of guidance about that. We would normally say that, the first 24 hours are probably the most significant, right? And normally if you're out of that 24 hours, it's unlikely that anything is then probably going to happen. So 30 minutes, I think, is a bit of a short window. A bit of a short window. I think, that's a difficult question to answer. I think if they've got any symptoms, you're best to get them reviewed. And as I say, you're right, often happens late at night. The parents are tired.
Yeah.
You're often dealing with multiple children. You've left them on the bed because you think they're safe on the bed, and then all of a sudden they're on the floor. I would say to parents, if you ever need to leave a child, them on the floor because they can't fall off the floor.
Yes.
Okay. So, and it's always that you've quickly just gone to grab a nappy from the other side of the room, or one of the children's just about to run down the stairs, or you literally take your eye off them for a second. Yeah. So I think the 30-minute thing is a bit arbitrary.
Yeah.
I very much believe in parents knowing their children the best. And if as a parent you have a concern, and I think you're right to have that concern, and you need to get somebody to review you.
Okay, that makes sense. Yes, agreed. I want to talk now about toxicity and our little ones eating things, because again, this is one of my biggest fears. I feel like when you have one kid, you can be very controlled with the environment they're in all the time. But now I have a 4-year-old, 3-year-old, and a baby, and obviously the elder kids, they have lots of they like to play with bits of Lego. Things break all the time and no one seems to clear them up. So there is literally small things all everywhere. Now, I want to talk about the things that we should be worried about. And I know we talked about batteries. These are the big ones that you see.
And the medications.
And the medications.
Yeah.
But before we get onto those, things like small parts of toys, pieces of Lego, Play-Doh, bubbles. Should we be super worried about babies or toddlers eating these?
So a lot of those products that you mentioned, like Play-Doh and bubbles, are non-toxic.
Okay.
So they'll be, certainly if you buy them from reputable toy supply, not all sheep, they'll be non-toxic, which doesn't mean that they're safe to eat, and it doesn't mean that obviously you should encourage your child to feed them, but it means that they won't get poisoned by doing so. Okay. Now things like Play-Doh, if your child eats a vast amount of Play-Doh, and I don't think that shouldn't ever really happen, because it smells and tastes pretty disgusting.
Yeah, exactly.
With that funny smell.
Yeah.
Then they will probably just get a bit constipated.
Same as sand.
Sand, yes, a bit the same.
Okay.
Sand is very non-toxic.
Vividly, my toddler eating bird poo off the trampoline. And
that would have been a relatively small amount.
Yeah, it was.
It was really disgusting.
I mean, I was horrified. Yeah, the whole thing. I was like, oh my God, why?
I've not seen that in A&E actually.
Okay, this is good.
Seen that. That's good. That will be fun. So bubble mix, again, if it's in a reputable toy place, is relatively, it is non-toxic. Again, doesn't mean that you want to drink it. More likely to cause a bit of skin irritation or eye irritation if it stashes in the eye. That's probably a bit more likely when they're playing with their skin. But if they drink it, if they drank a quantity of that, again, not dangerous or toxic, but probably will give them a bit of a stomach upset, might give them diarrhea, might make them vomit a little bit. So all of those things we don't necessarily worry quite so much about. Small toys, pieces of Lego. Weirdly, we seem to see them more in noses and in ears. Children love to put little things up their noses and in their ears. Little beads, little pieces of Lego.
I don't know. How do you get that out?
So there's different. Sometimes we have to send them to ENT to get it taken out. There is a very old school thing called a mother's kiss. I don't know whether you've ever heard of it, which we still try and use, and it really works sometimes with foreign bodies up noses. So if you've got a bead or a small piece of Lego, a child has it up one nostril. We block the other nostril, and we get the mum or the dad to seal their mouth over the child's mouth and blow very hard and very fast. And when you do that, the air that you blow in actually then comes back out of the nasal cavity. This is what the foreign body is.
This is great. I love this.
Magic. Mother's kiss.
Gonna say that one.
Fairly easy thing to try. Not necessarily trying at home if you've never done it, but we sometimes try and do that. But sometimes it's just we have to get something up and we put hooks that we can get behind it and put it out as long as you can see it. We never do a blind sweep. You never do that. If the child's choking or anything, never put your hand or finger in anywhere if you can't see anything. If you can't see anything, that needs to be looked at. A doctor for sure. Small pieces of Lego that are swallowed, etc., are probably fairly harmless. But again, if you've got any concerns, then come and see us. But we've talked about coin. I know we want to talk about more things that really are emergent.
Yes. So moving on to things like batteries, magnets, medication, and coins. Now, the batteries and magnets, especially, let's start with those, because they are two that you see these horrendous videos online. Child ingests one of these, and what window are we looking at of getting medical help?
Well, ideally, you want to try and have them removed within a couple of hours. Magnets are obviously concerning, especially if they swallow two magnets.
Yes,
because if those two magnets then snap together and they snap between a piece of tissue, like part of your esophagus, esophageal wall, then that can cause necrosis of that wall. It can cause lack of blood supply. It can cause it to perforate. You can get into all sorts of trouble. So that's why, certainly with magnets, you definitely need to, that's an emergency, and you need to proceed straight to the nearest emergency department.
What do you do in that instance? Like, is that are you operating?
No, so that will be the gastroenterology team, who are the team that can use the endoscopy. We took it down, and we have two pediatric gastroenterologists at Parkview who specialise within that field of pediatrics, and they will do the gastroscopy and retrieve it.
Wow.
Yeah, and that's the same with batteries. So batteries again are an emergency.
Yes.
Especially the button batteries, which I think most parents are aware of. Yes, react with the acid and things in the stomach. They can then become very acidic. They can cause perforation of the wall again and cause bleeding. So that's the real issue. But there is some first aid that you can try. So there's been some evidence about honey.
Okay.
Yeah. So if you have a child over 1 who think has swallowed a button battery, and if there's no contraindications to you giving that child honey, it's been shown to decrease the risk of the battery breaking down and the necrosis and the issues that can then cause to the tissues. So 10 mils of honey every 10 minutes is the recommendation whilst you're on your way to hospital.
So interesting.
Yeah,
That's a great
aid.
Let's say you don't know that your child's swallowed a battery. You've had your baton, they popped the battery in their mouth and it's ingested. What are symptoms that we could look out for that might show that something is wrong?
The problem with a lot of these things are they generally don't have symptoms until it's too late, right? So that's the problem with wondering, do you do something or don't you? Said to you before, and I'll say again, if you're unsure, that just go and get advice and get reassurance, and we can do imaging and try and work out if they have actually swallowed a battery. But yeah, often they'll have no symptoms. They may have a bit of pain, they may vomit, but these will probably be later symptoms, and they're generally not very good at telling us that they've done these things. Like kids have beans and things up their noses for days before they tell their parents. So they generally won't go, "Oh, hi mum, I just was in there and I swallowed a battery." They just won't tell us because they understand they've probably done something that mummy and daddy might get a bit annoyed about.
So nowadays,
I mean, you can't, you just have to. I mean, obviously, if you've got any batteries, you store them up high, in a childproof container, same as you would with all your medication, all your cleaning products. Need to be up high in childproof containers. You can try and seal the remote controls or the things that have to make sure that there's no loose batteries lying around. It's difficult because you say a lot of products need the button batteries. Trying to take the batteries in so they can't get the cover off is one of the ways to try and stop them from getting them out. You just have to do your best. You do your best.
I want to talk about medication now, and obviously the same applies about keeping it obviously out of the way of your children.
Yeah.
Now, things that have happened, for example, in our household before, which God makes us bad parents, is, for example, if one of our kids is sick, I might give some Calpol and then my husband might not have realised I'd give some Calpol and then like give some more Calpol. Now, we've never had a really bad incident with that. It was actually with some cough mixture that it happened with once. And my daughter was quite dosy, but the school nurse was like, she's absolutely fine. Like the limit is quite high.
Yes.
But it happens. What's for child's medication, Calpols, Nurophens, all these kind of things? Overdosing.
So a lot of the time when you're looking at dosing of Calpol and Nurofen, it's actually, there's a maximum dose over a 24-hour period. So certainly in adults, you shouldn't take more than a gram of paracetamol every 6. So that's 4 grams in 24 hours. So as long as you don't exceed that 24-hour dose, you're pretty safe. So if you give a double dose of Calpol quite close to each other, you just need to make sure that you then work out how much they've had within a 24 hours. So, I mean, if it's not above the recommended dose of 24 hours, you're probably pretty safe. Paracetamol is certainly one of the things that we'll worry about more as we go on with paracetamol is dangerous than overdose. It can cause liver failure. It can cause many problems. Paracetamol. And unfortunately, it's one of the tablets that tends to be the most easy to get hold of. I'm talking about more teenagers and above, really. Yeah. That's why places like the UK, you can only buy 2 packets of paracetamol when you go into Boots now. You can't buy 10 packets.
Well, that's good.
But yeah, it's more over a 24-hour period you need to look at. Things like multivitamins and those chewing gummies and things. That's often that kids will eat a lot of. And iron, certainly, that if they're iron containing multivitamins, iron is something that can be quite toxic to children. So that's that would definitely be something that you'd want to contact the boilers unit about or go to A&E and get that reviewed.
That's things like obviously now Muslim motherhood comes with all sorts of problems. We've been told they've got ADHD, so I now have ADHD medication. Been on anti-anxiety medication. There is a lot more of this, and obviously as a result, parents have a lot more pills at home. So what happens if a kid got hold of so often?
You definitely need them to be seen. And also a lot of the time it's weight-based as right. So yes, above X milligrams per kilogram will be toxic. So you're never going to be able to work that out as a parent. Yeah, and your child has got that toxic dose or not. So then there is a national poisons diet. Yes, because certainly if it's a bottle, you're not necessarily sure how many was in there. Yes. So that uncertainty certainly is something that makes it very difficult to assess. Yeah. That's why sometimes you need to go into hospital. You might have some levels checked. They might have to monitor the child.
Fine. Always goes to hospital.
I would say that. Unless it's like, one extra spoonful of Calpol or whatever, which is not going to cause an issue. But yeah, it's the uncertainties which causes people to think, need that reassurance and need to seek that medical advice.
For sure. I want to touch on one more thing regarding poisons and bits and bobs. Now, an interesting one here, because it doesn't happen very often, but obviously we are home to is it called the redback spider? Is it a redback?
I know, having lived in Sydney, we had a lot of poison.
There is a particular type of small, I think it's a redback spider that likes to live under wood. Do you get many like spider bites, snake bites?
Surprisingly few, actually. I think if this is if people are listening to this podcast in the UAE, that Rashid Hospital, which is the government hospital, is the hospital that has all the antivirals. And they have the rabies and treatment as well.
So they're the only ones?
They're the only one. They are the government hospital. So if you have someone who thinks been bitten by a child that's been bitten by a stray dog and you have those concerns, Rashid Hospital is the hospital that has all the relevant treatment. We obviously would always see them, but generally end up sending to that.
Yeah. Okay, fine. And again, with, like a dog, let's say you get bitten by a dog. Are there signs that this dog has got rabies? Like that?
Is there the rabies in the UAE is really not a thing. But we still always would treat obviously all called domesticated dogs are vaccinated against rabies, but there's obviously a lot of wild dogs around, especially out in the desert. Yeah. So we would always really assume that if you get bitten, that there's a chance there's rabies, and we will therefore treat prophylactically for it.
Choking.
Okay. Yes.
Choking terrifies me. We're weaning a baby at the moment, and every single time he does this, please. And then I'm desperate to get my finger in his mouth to wedge it out. I'm like, don't take a breath, it's fine. But firstly, let's start with babies. Babies that are choking. What is the difference between them gagging and them choking? And when do we worry that they are choking?
It's probably a time-based thing. When they're gagging, it's probably a much shorter episode.
Yeah.
Whereas a child who's choking will continue to exhibit those symptoms for longer. Certainly, as the children start to get a little bit older, so more the toddler years that we're talking about, and also certainly into them, young adulthood and in adults, there is a universal sign of choking, which is putting your hand to your throat. And if anyone does that, they're choking.
Okay.
Obviously, yes, that is a universal sign of choking. The gagging is, as I say, is a much shorter episode. Choking is more prolonged. And I think you're right. Choking is one of those things that we as parents are all really worried about. I had to slap my youngest when she was choking on a piece of broccoli when she was younger, and it took a while. Seemed like it took an age for it to come out, but it did come out. There are certain foods that are much more prone to children choking on: grapes, sausages, cherries, tomatoes, blueberries, nuts, popcorn, hard candy, any of that. So, my children were probably 12 until I let them eat a whole rib, because I actually saw years ago. I've seen one or two children choke and die on grapes, on whole grapes. So, cut them into quarters. Sausages, you shouldn't cut them into round, you need to cut them down the middle.
Yes.
Cut them up.
Yes.
Right? So there's certain foods that are commonly eaten by children, which you need to be super careful about. The supervised eating is very important. So not letting the children sit and eat on their own necessarily. And also making sure they're not eating quickly. Because when you eat quickly, you're much more likely to choke. But there's obviously certain first aid we can try and do if the child is choking. Generally, your first thing that anyone does is to start to cough, to do that coughing kind of sound. And if they're coughing, you want to encourage that cough, because that is the body trying to expel what's called stuff.
Yes.
Okay. So if a child is coughing, just try and stay calm and try and encourage that cough. It's when they're not able to cough that's when we need to start to intervene. And that's what we need to do. Think about the back blows and the abdominal thrust. So the Heimlich maneuver, which I think most people have heard about. Yeah. Backbone. So you use the palm of your hand in between the shoulder blades, and it's really 5 firm back blows, and then you do 5 abdominal thrusts, and then you alternate it. The important thing to do, I know people who are listening to this won't be able to see, but is to have the child in a position where their head is down, so that if the foreign body does come out and then doesn't go back again.
Yes.
Right? So if they're small enough, you want to actually put them over your lap. Yeah. A good way to do it. So with their face down, and you can do the back blows like that because their head is then.
Yeah.
And then when you stand them up, do the chest thrust, and you stand behind them, have their head forward so that anything, gravity will bring anything out. If they're choking and they're not coughing and they become unresponsive, that's when we to start CPR.
Okay. What is the window that we have? Let's say a child is choking and you've tried everything and nothing is happening. The child is becoming unresponsive. Yeah. Like, what is the window for intervention, first to get to the A&E or for an ambulance to arrive? How long do we have? Because that's always what scares me the most, is if I'm stuck in a situation where I can't do anything, like, how long do I have to be able to get back up, basically?
I think this brings up the important point of making sure that everybody is first aid trained.
Yeah.
So I think as parents, we're quite good at doing some first aid when we have our first baby.
Agreed.
And then we forget about it for our subsequent children because we're so busy.
Agreed.
And these are skills that you will not be confident to use unless you regularly practice them.
Okay.
So I think, and I'm actually a big believer in this, so we're all becoming the sandwich generation as well, where we've got all the parents, like, that we all know how to do some basic first.
Yeah.
Hugely impacts your chance of survival. Your chance of surviving out of hospital cardiac arrest with no CPR and no life-saving efforts is incredibly low. Some good quality bystander CPR and management, your chance of survival goes up a lot. Obviously, sometimes it's having the confidence to start it. Yes, CPR. People can do some funny things when they're going into cardiac arrest. They'll still breathe, but they might not be breathing normally. People will be like, "Well, they're breathing," but if it's not normal breathing, it's not responsive, then they're in cardiac arrest and need to start.
Fine. This is good to know. It reminds me I need to do this. Okay, fine. And things that, just back to the things like Lego. Let's say we're choking on a piece of Lego. It always has to come out. It never goes down.
No, it can go down.
Okay, fine.
Go down. And we talked a little bit about coins, and coins are some of the things that we do see not infrequently that children swallow. And the majority of time, these smaller foreign bodies, like calling just one piece of Lego or a bead, will just pass without any issue. Coins being that bit bigger can sometimes get stuck. There's about 3 narrowings in your food pipe, certainly in pediatric food pipes, where things can get a little bit stuck. Once things are in the stomach, they will generally pass out without issue. This is different, obviously, for the magnet and the battery thing that we've already discussed. That's very different.
Yes.
Talking about the not so dangerous things, and obviously sharp things as well. If they swallow a sharp thing, that's also something that you might have to remove and let pass through the GI tract.
Yes.
But sometimes what we need to do is we need to X-ray to see where the foreign body is, and if it's got past a certain point, then we can be quite happy that the child proves that out eventually.
Yeah. Right. Okay. Good to know. Water safety. This is another one that terrifies me, and I've always been. All my kids have been. Yes, it's from the age of 3 months, because, again, even when what I love about swimming and safety here, or the swimming lessons, is when they are that small, they teach them that if they fall into a pool, not to panic and roll onto their back, which I think is phenomenal, because it could happen, but if they know,
it does. The commonest cause of toddler death in toddlers is the worldwide is drowning. As we said, it doesn't have to be in a swimming pool or in the sea. We're talking about drownings that can happen at home. Toddlers can drown within an inch of water in a bathtub. The toilets as well, they can be looking at something in the toilet, they can fall into a toilet and they can't get themselves out. So yeah, it doesn't have to be a big body of water for that to happen, unfortunately.
I mean, again, so let's say a toddler has drowned or is drowning. What is the protocol after that? What do we do?
Take them to hospital. I mean, if they're drowning and they're in cardiac arrest, you need to start CPR. You need to get them out of the pool, you need to get them onto hard service, and you need to start CPR.
Okay.
And get help as quickly as you can.
Okay.
Some children will go under momentarily, and then they'll come up and they'll cough and they'll sputter, and they're absolutely fine. We've had that happen.
Yes.
Children, haven't we? That's not necessarily something that we need to worry about as long as they are fine. Usually there is something called secondary drown.
I was about to say.
Which can happen a bit later on. They can get a bit of fluid in their lungs and they can become a bit breathless and a bit unwell. They would definitely need to seek medical advice.
Okay. If
you've got any concern that they've been submerged for a more prolonged period of time, I'd get them checked out.
Okay.
But yeah, you need to start CPR. I mean, you talk about swimming lessons, it's interesting that the American Association of Pediatrics suggests swimming lessons from the age of 1. That has been shown to decrease the risk of drowning in that age group. It's a bit more unclear whether it does. Obviously, you say, they can flip on their back. That's great. It doesn't make them invincible that they will do that. But obviously it helps, under one, it's important to get them in the water and to get them confident and happy in the water so that their steps of progression to swimming will be much easier and they'll enjoy it a lot more.
Yes.
So certainly swimming lessons from 1 and overs has been shown to decrease the risk of drowning in those younger years.
Yeah, because I mean, what I see anyway, and again, I've always been very, very lucky. My eldest 2 kids have always been very confident in the water and have loved it,
Yes.
which is great. But normally what happens when a kid falls in, they panic, and when they're panicking, they gulp in more water. They're not, they freak out. Whereas again, what I love about swimming lessons is a lot of it is they sit on the side and they fall in, and it's all about learning how to turn around and grab. Which, again, I mean, mine have been able to do from about the age of 1. And I just think somewhere where there's swimming everywhere.
And it's not, in this country, it's not, as far as I'm aware, it's not legal that you have to have a pool fence around your pool. In Australia, it is a legal requirement. If you have a swimming pool, you have to have a fence around it.
I agree with that.
And that's not the case here. So I think swimming pools are always deeply scary with young children. Once you've gone to have a play date, there's a couple of other friends there, there's a couple of other children there, it's a bit busy, you're inside with your 4-year-old because he needs to go to the loo, they make you feel very uncomfortable. Supervision, there's no replacement for close supervision. There is none. And it doesn't matter how many swimming lessons your child has had, it doesn't mean that they can't drown.
Where is, I mean, what is the danger period? Obviously, once they can swim, percentage of drowning decreases, obviously, unless they have a hand injury or something around.
Yes, of course. I mean, 1 to 3, that kind of, most children, even if they stop swimming lessons at 1, probably will become confident, able swimmers, about 3-ish, probably about then, I think. So up until that point, really, they're still very much at risk. But once they can swim and they can dive in and they can come up and they can take a few breaths, even though their head's underwater, they're strong enough to bring their head out.
Yes.
Should they go down again
And
shout. Although, as we said, silent drowning is relatively silent, unfortunately, and people think of it as being this big splashing around, and it's not, and it really isn't. So supervision is really the key to keeping children safe around water.
I want to just talk about first aid and empowerment before we start to close out. Now, we've obviously talked about having first aid training and CPR courses and having confidence in being able to do those things if we need to. I also think it's very important that anyone else who's around your kids knows how to do this. Nannies especially. My worry with the nannies, and not all nannies are like this, but our nanny, for example, she is wonderful, but she lacks confidence.
Yes.
And my fear would be that she would panic in a situation, even if she knew how to do it.
Yeah.
Is there anything else we can do to kind of really try and empower them or give them more tools to be able to perform if they need to?
I think the knowledge is the power.
Yeah,
I do. And I think if you keep allowing them to do that course every 6 months,
yes,
I think that is
right.
I really think that's the key. And I think that's the only way you're going to build that confidence in them, is making them feel empowered that they have the knowledge to help if they need to.
We need to have that home in our first aid box.
So as I was thinking about this, it was a question you'd asked me about, and I was trying to think about what I would have as one of my main things. I mean, obviously antiseptic.
Yeah.
Sterile saline to wash something with.
Yeah.
Dressing, to put on a bandage, something that either can treat the small cut or the abrasion that, doesn't need hospital, or something to cover it, clean it and cover it in the meantime before you take them to hospital. So just simple things like that, really. Or cold pack's quite a good idea.
Yes.
Just to have, be careful never put it directly on the skin. You don't want the skin to burn, get cold burn. So, wrap it in something, put it on. If there's a bit of a bruise on the head, that always helps. Cling film is another thing. And I'll tell you why. There's a burn. Yes, it's great coverage for burns. We often see, certainly in this region, we see people who've had either a burn. Culturally, there's lots of ways to deal with these issues. Coffee is quite a common thing. Coffee granules that people put on wounds, turmeric or saffron, which can then become quite difficult for us to remove from the job we need to see it. So our general advice would be not to put anything like that in the wound, just to give it a clean and cover it. But cling film is brilliant, especially for burns. It doesn't stick. Because it doesn't stick. It sticks to itself only, so it doesn't stick to the skin. It doesn't stick to the burn. Burn first aid is very important. A lot of people put ice on them and things. Cold running water.
Yeah.
For at least 10 minutes is what you need to do. If you can do that safely without making the child hypothermic or yourself hypothermic, but that's the best first aid initially for a burn, is running it under cold water for about 10 minutes. Stops the burning process.
Yeah.
And then just cover it with cling film and then head to them. And the other thing is obviously a bit of Panadol, antihistamine. But that's probably would be in my first aid kit, to be honest. And maybe some gloves if you were worried about it. But they'd probably be my top things for a first aid kit at home. thermometer as well. Yes.
Yeah, my favourite thing.
I seem to use it every day. I thought something. I just do the kind of like, are you feeling a bit hot now? I'll give you some gas.
Yeah. God, I mean, this is the thing that we've got a teething baby at the moment. He just feels like he's hot all the time. Feels so sorry for him. I'm like, get them out. He was up at 5 this morning, so upset, and because he's also like pooing like a child.
They get a very upset stomach with it, don't they? And he's like 7 poos a day.
How?
I know, it's such a difficult time for them. And you're tired, and they're tired, and they're tired.
Everyone. And God, I feel so sorry for him. Before we round up today, I just wanted to ask about closing pieces of advice. So if you were to leave us with a couple of tips,
Staying calm.
what would they be?
I think get yourself on a first aid course.
Yeah.
I really think that's probably the best way to stay calm in an emergency. I think when I'm involved in emergencies at work or out of work, the difference between how I respond to how a non-medic responds is I feel very calm about it because I know what I'm doing and I know I can help. I'm suggesting you need 25 years of A&E experience to be like that. But certainly, I think keeping yourself up to date with the first aid course it is one of the ways to stay calm, so that you know what to do. Just really, as difficult as it is, it's supervision. A lot of the things that we've talked about, things are always going to happen. Accidents are going to happen. That's part of life. I think close supervision and awareness of hazards around the home that you wouldn't necessarily have thought about. There's little things like, there's cords, blinds. They can be a hazard. I mean, certainly with your first child, it's child-proofing your home. So it's the stair gates, it's the locks on the cupboards, it's moving the medication, the chemicals and cleaning fluids up to high cupboards. Make sure you don't leave a cup of tea on the surface. It's just child-proofing your home, supervision, and keeping yourself up to date with regular first aid courses. Love this.
And I mean, look, I have been to Parkview A&E a few times. It is phenomenal how quick and efficient A&E works in this country.
It is.
Obviously, having lived in the UK for a long time, and I mean, I know the NHS is stretched, but it is, every time I bring a child, especially to A&E, I am whizzed through so quickly. And I do think it is amazing. So I feel like if you haven't ever been to A&E before and you're worried of going and sitting for hours, it's not a thing in this country, really.
No, it's not. We're incredibly lucky that we live in with the health that we have access to. It is amazing. We obviously have busier periods and we have busier times of day, and we obviously have times where we have very sick people that take priority as quickly and in a timely manner as we can, and we're constantly striving to improve that. We really try and see everyone within 15 minutes of arrival. Obviously, if anyone's life-threatening, we see that. But others, we really try and see people as quickly as we possibly can, because we understand it's a stressful time. We understand people don't want to spend any longer in A&E than they need to. And we want to reassure people and help them as quickly as we can.
Most of the time, one of my biggest fears coming to A&E is obviously you're going to a place where there could potentially be a lot of very sick people with other things over injuries.
And that's a very British. That is a very British fear.
Is it?
Yes, just right. But no, you'll find that they apologise for coming to emergency. There's a lot of apologies going on. And as I said right in the beginning, we would much rather see people and reassure them, and then be able to say, it's fine, everything's good, you're okay, come back if anything worsens. But we'd much rather see people than people sit at home worrying about something happening to their child, because there may be those small occasions where you don't think that then something does happen.
Yeah, exactly. Better to be safe than sorry. And I mean, I think we've made this very clear already. But if anyone wants to come and find you,
well, where are you? I work in the emergency department at Mediclinic Parkview Hospital. We are open 24/7. Not there 20. We are fully staffed by emergency medicine specialists, and we have all been trained in the art of emergency medicine. And we have 24/7 paediatric emergency medicine specialists as well. So we are very well covered, and we will. So we're there every day, all day, if you need us.
thank you for coming on.
Enjoy.
Thank you. We will see you.